Hi, my name is Kim Watson, and I'm a speech-language pathologist here at MidCoast Senior Health Center. And what I want to talk with you about now is how to keep our patients safe in terms of their swallowing status. Because the patients that we work with are at very high risk for developing pneumonia. Pneumonia is one of the #1 causes of death among the elderly population. And there are things that we can do here to decrease their risk of developing an aspiration pneumonia. And that's what we're going to talk about now. So one of the most important things that you can do to decrease a patient's risk of developing aspiration pneumonia is to make sure that any time that we give them any oral intake, food, drink, medications, any of those things, that we make sure that their positioning is optimal. So what that means is that we want to make sure that the patient is sitting fully upright. Ideally, we want people out of bed sitting upright in a chair whenever they eat or drink. Sometimes that's not possible, and so in cases like that, we want to make absolute certain that if they are in bed, that we've done everything we can to bring the head of the bed up to the highest position, and that we've used pillows or blankets or bolsters of whatever type to help aid their positioning. The most important thing about their positioning is that their trunk is upright, but even more so than that, that their head is straight ahead, like mine is right now. What we want to avoid is that their head is tilted back like this, because when they're in that position, when their chin is up like that, it lends itself to having their airway open. When you think about CPR, the first thing we do is we lift the chin to open airway. So we absolutely do not want them eating or drinking with an open airway. So it's important that we put pillows behind their head or use blankets so that they're looking straight ahead when they eat. If their chin is down a little bit like this, that's okay. That can actually help to close off the airway. So it's okay if the patient is in a position such as this. But we do not want to be giving them anything to eat or drink when they're in a reclined or semi-reclined position, and we do not want the chin up. So making sure that you do everything you can to make sure their positioning is optimal is the #1 most important thing that you can do to help prevent aspiration pneumonia with our patients. The second thing that you can do is to make sure that whenever we give them food or drink, that we're giving them the proper consistency. Not everyone is on a regular consistency diet. Some of our patients and residents are on modified consistencies, which is typically determined by a speech-language pathologist, sometimes by nursing, but it's done so that they can chew and swallow food more easily. And so when we serve them food from the dining room or for those of you who work in the home, you want to make sure that you know what their recommended diet consistency is. For example, if they are supposed to be on a mechanical soft diet, then they shouldn't have anything hard to chew, crunchy, tough breads or meats should not be offered to them. Some of our patients are on ground meats, which are often served with gravy to help keep the meat cohesive. We need to make sure that if that's what their order says, that's what we're serving to them. And some of our patients are on pureed foods if they're really having a difficult time. So always check the tray slip or check the doctor's order to make sure that whatever we're giving them is the proper consistency. The people in the kitchen, for us here at the Senior Health Center, they're the first line of defense, but the rest of us are the second line of defense. We need to serve as a double check. When it comes to liquids, sometimes we do have our patients on thickened liquids. The most common thickness that we recommend is called nectar-thick liquids. And the reason that we sometimes put patients on nectar-thick liquids is because they're having a very difficult time controlling regular liquids, and they're slipping back over the base of their tongue, and they're aspirating on them. By making the liquid a little bit thicker, we can control the rate of speed in which the liquid travels, which therefore gives the patient a little bit more time to control it. Also, the weight of the thick liquid, that added viscosity, gives them improved sensory feedback, and they know where the liquid is in their mouth, and therefore they can control it better. The important thing to know is that if a patient is on nectar-thick liquids, the liquid should still be drinkable. So I brought some nectar-thick liquids to show you what the consistency should look like. It should be the consistency of syrup. as you can see, it still pours, and it's something that a person would be able to pull through a straw. It's a little bit thicker than a regular liquid, but it's not so thick that the person should be deterred from drinking it. So that's important for you to know, because if you check the order and it says nectar thick liquids and you notice that the liquid is too thick because thickener was used and it thickened as it stood, you're going to want to add some water to thin it back down. If it's too thin, you're going to add some thickener to thicken it up. We use prepackaged thickeners here at the Senior Health Center, which takes the guesswork out of it. But for those of you who are working in the home and you're having to thicken the liquids themselves, it's important to use that rule of thumb so that people don't become dehydrated. Make sure you check. Some patients are on a thicker consistency than nectar. A honey thick liquid should be the consistency of honey. A third thing that you can do to make sure that patients are at the least risk for developing an aspiration pneumonia is to be absolute certain that we provide excellent oral care. The reason for this is because everyone aspirates small bits of their saliva, but if your saliva is laden with bacteria, you're at much higher risk for developing an aspiration pneumonia. And that is the case for a lot of our patients who have a compromised immune system. So it's important that we make sure that after every meal that their mouth is clean, that we do good oral care in the morning and again in the evening, so that their mouth is clean, and if they aspirate a little bit of saliva, it won't put them into a compromised position. If you have any questions about a patient's swallowing status, it's very important that you notify the nurse, the doctor, or the speech-language pathologist, so that a speech therapist can get in and do a full evaluation. Some of the signs and symptoms to look for is if you notice that a patient is coughing during meals but not coughing otherwise, or if you notice that they have a wet, gurgly quality to their voice, if you notice that they have lung sounds and a low-grade temp, or if they're complaining that food is getting stuck. Those are all the common symptoms that might be a tip-off to you that a speech pathologist should get in there and do a more thorough assessment so that we can make recommendations that would make them safer with their swallowing. So all of you play a very, very important role in making sure that our patients stay safe and that they don't end up developing a pneumonia while they're in our care. Thank you.